moderated caucus on the agenda treatment of mental health globally.
Wait,
Of mental health.
okay.
Thank you.
Okay, that is another. What is the total time, Eritrea?
15 minutes and like 1 minute per delegate.
Okay, could you possible to make it 20 to 1 since all the two motion is 20 to
Yeah,
1?
yeah, okay, sure.
Okay, that's cool. Can we make that into 20 to 1?
Yeah.
All right. Wait. Okay, that is another. Thank you so much, delegate. So we're gonna vote on the delegate of Vietnam first, followed by Argentina and Eritrea. If the delegate of Vietnam motion passes, all the two motions failed and not put in the vote. So with that being said, if you're in favor with delegate of Vietnam motion, moderated caucus 20 to 1, please raise your hand, delegate. We need at least 30 votes. If you're in favor with delegate of Vietnam motion, please raise your hand. We need at least 30 vote delegate. Please raise your hand. Okay, I will wait for another 5 seconds.
Chair, can we count the number of heads before the voting?
What? I'm sorry.
Can we count the number of heads before the voting? The number of active participants?
No, it's 30. Simple majority will be put in the 30 because that will be the same. I think this is the same participants in here. If
Okay,
all
Chair.
okay, so if all the three motion failed, we're gonna put head count again and revote on your motions. Okay, so
Okay, Chair.
it fails by 17. So let's move to delegate of Argentina motion. Moderated caucus 20 minutes to 1. Please lower your hand, delegate. Please lower your hand first. I'm sorry. Please lower your hand. Please lower your hand, delegate. Okay. Okay, so we're gonna vote on the delegate of Argentina motion. If you're in favor with delegate of Argentina motion, please raise your hand. Delegate, we need at least 30 votes. If you're in favor with delegate of Argentina motion, please raise your hand. We need at least 30 votes. If you're in favor with delegate of Argentina motion, please raise your hand. Is possible solution for the agenda by countries nationally and internationally. Its solutions for mental health. Okay. I will wait. I will wait for another 5 seconds. Okay, it fails by 22. It fails by 22. So please lower your hand, delegate. Please lower your hand. Please lower your hand, delegate. Please lower your hand. Thank you so much. Please lower your hand. Okay. Yes, delegate. If you're in WHO 1, you can leave this meeting and rejoin so you can put in the um, main room. Okay, delegate, please lower your hand. Okay, we're gonna vote on the delegate of Eritrea motion. Moderated caucus 20 to 1 treatment of mental health globally. If you're in favor with delegate of Eritrea motion, you can raise your hand, delegate. You can raise your hand, delegate. Okay, please raise your hand if you're in favor with delegate of Eritrea motions, which is unmoderated, which moderated caucus. I'm so sorry. With the treatment of mental health globally, if you're in favor and you want to speak in this moderated caucus, you can raise your hand. Fails by 22. Okay, it fails by 22. So under the chair discretions, so we're gonna do a quick head count to know how many delegates are active in this committee. So please lower your hand. Please lower your hand, delegate. Please lower your hand. We will do a quick head count. Okay, so delegate, if you can hear my voices right now, please raise your hand. Delegates, if you can hear my voices right now, you can raise your hand. Please delegate, if you can hear my voices and you're active in this committee, please raise your hand. We need to move forward. How about the others like Netherlands, Central African, Chad, Germany, delegate of Portugal, Philippines, UAE? Why not raising your hand? Please kindly raise your hand if you can hear me and you're active in this committee. Okay, so we have 53 delegates. Please raise your hand if you can hear my voices loud and clear. Please raise your hand. Thank you so much. Okay, so please raise your hand, delegate. How about the others like Indonesia, Fiji, Portugal, Libya, Chad? Why are you not raising your hand? Please kindly do that. Okay, I will wait for another 5 seconds. Okay, there is a 52 delegates that active in this committee. The simple majority would be 27. 27. Please lower your hand, delegate. Please lower your hand. Please lower your hand, delegate. The simple majority would be 27. Please lower your hand, delegate. Please kindly do that. Okay. Okay, delegate. So we're gonna vote on these motions based on the order from Delegate of Vietnam first. If you're in favor with Delegate of Vietnam motion, which is moderated caucus, please raise your hand. The simple majority will be 27. If you're in favor with Delegate of Vietnam motion, please raise your hand. I will wait for another 5 seconds. Okay, this motion failed by 10. Okay. So we're gonna vote on the Delegate of Argentina motion. Delegate, lower your hand first. Please lower your hand first, delegate. Please lower your hand first. Okay, so delegate, if you're in favor with delegate of Argentina motion, you can raise your hand now. Please raise your hand now if you're in favor with delegate of Argentina motion. We need at least 27. If all the three motion is failed, we're gonna back to the GSL and listening all the speaker lists again. So please, if you're in favor with delegate of Argentina motion, raise your hand. I will wait for another 5 seconds. Okay, okay, it passes. Okay, it passes. All right, delegate of Argentina, would you like to speak first or reserve your right?
I'd like to speak last, Chair.
Okay, wait. Wait. Okay, co-chair, could you? Okay, that's cool. The co-chair is typing the topics, and co-chair, you can take over.
Yep. Did Argentina say they'd like to be the last speaker?
Yes.
Yes, Co-Chair.
All right. We're going to be taking 20 speakers for this. Delegates wishing to add their name to the list can raise their hands. Delegates who have still not spoken since the starting of this session, please do give it a try. All right, delegates, we've selected the speakers. Delegate of Greece, Delegate of Greece, Delegate of Greece. All right, moving on. Finland, Finland, chat. So, Honduras, I failed to lower my hand. Okay. Finland, Eritrea.
Am I audible?
Yeah.
Thank you, Chairs, for recognition. Because of increasing mental health disorders, the World Health Organization came up with Mental Health Action Plan. Because people with mental disorders and mental illness, they are kind of denied the right of work and to go to school. That may soon change thanks to WHO's new comprehensive mental health action plan. The plan is a call to action that will help guide countries as they strive to ensure that all citizens with mental disorders receive the treatment they need. The plan has four main objectives: strengthening leadership in mental health, providing comprehensive mental health and social services in community based settings, implementing prevention and mental health promotion strategies, and strengthening research, evidence, and information systems for mental health. The plan also includes a menu of policy options that countries can adopt as they implement the recommended actions. Thank you.
Thank you, Delegate. Moving on. Vietnam.
Am I audible?
Yes, Delegate.
Yeah, thank you so much. The delegate of Vietnam would like to refamiliarize the other delegates with the staggering figures that the World Health Organization has recently released. Around 300 million people. The number has increased to 300 million people that are vulnerable to mental awareness. So there is a need for regional cooperation. So Vietnam recognized the potential of its own country for in the solutions of regional cooperation and the work at the ground level. At the same time, we need a comprehensive approach towards mental awareness, and we have to understand that it's not an isolated issue. It's an issue that impact economy and at the same time is affected by several factors. So there's a need to first recognize the issue and then work upon it at the ground level. Thank you.
Thank you, Delegate. Moving on, Delegate of Paraguay.
Hello.
Yes, Delegate,
Yeah.
proceed.
So I'm really glad for this opportunity, and I'm really want to say one thing that after all the discussion that we've had, I really wanted to focus on one important thing that in all of these cases, there's one thing that remains constant that health issue, especially the mental health issue, stands in every aspect of our lives. And the most important thing that we need to focus on in this the education that people need to know that everyone needs support. As you see the world today, it is more getting isolated from each and everything, especially when it comes to money and the families. So somewhere this needs to be catered from the schools to the office cultures to every places, which I guess the government should come into policies so that every places which are actually having such issues. I mean, like, if you know that you have these issues in every aspect, so if government comes out with policies and the organization itself works on all of these things, this can be catered from small levels, from the school levels to the office levels, so that it can be catered in a much better way. Thank you.
Thank you, Delegate. Moving on, Thailand.
Yes, am I audible?
Yes, Delegate.
Hello, can you hear me? Okay.
Yes, Delegate,
One
proceed.
of the many causes of mental illness. One of the many causes of mental illness is high expectation from teenagers. Many responsibility have been thrown upon teenagers, especially if they're from a poor family. Thus, Thailand advocates for a UN sanction policy that gives poor Thais free of cost school education until high school and a government approved certificate of education, which will be given to all graduates that will allow them to get a job with a reasonable income.
Is that all, Delegate?
Yes, thank you.
Thank you, Delegate. Moving on, Ecuador.
Am I audible?
Yes, Delegate, proceed.
Thank you for recognizing me. I'm the delegate of Ecuador, and I would like to talk on this topic. So, Ecuador had encountered multiple armed conflicts in the past few decades with its neighborhood Colombia and Peru. The aspect which I'm talking about right now plays major role in posing a substantial threat to communal harmony and hence impacting the mental health of its people. There are many objectives of mental health action plans, like reinforcement of effectual leadership and governance for mental health, implementation of strategies pertaining to the promotion of mental health and prevention of psychotic disorder, development in the domain of mental health. Uh, like mental health disorders and psychosis are not intrinsic or inherent, but consequential. For Ecuador, natural calamities pose strong psychological impact, affecting the overall mental health of the general population. An official mental health bill needs to be implemented in Ecuador so as to promote
Thank you.
mental health care policies. Thank you.
Time elapsed. Thank you, Delegate. Moving on, India.
Yeah,
Delegate.
can you hear me?
Yes, Delegate.
Okay, so thank you for having me once again. So definitely there is various solutions that can be given by various people. So first thing which we have to do is spread awareness. That's the main thing that we have to do, and these awareness should be spread to city as well as to the rural areas. And also the individuals has to be educated how to handle when they face such issues as well. And also it's important to educate the family members when their family other family members go through such issues, how to handle those people as well. And also, as one of the delegate highlighted, yes, it is important to have programs in schools calling one particular section of people but to various people as well. So it is important to have program in school, college and offices as well. And also it is very important to address the issues that causes mental issues as well. So those has to be done as well, and also to educate on the effects of the mental issues. So these will definitely will help. Thank you.
Thank you, Delegate. Moving on. Peru.
Am I audible, please?
Yes, Delegate.
Okay, this is Delegate of Peru. Actually, I think the global treatment to mental health should be, you know, awareness. There should be awareness of this very illness, perhaps among school children, both in a formal and an informal setting, telling them that such sickness exists and they should watch out for it. Secondly, I think there should be detection. This disease should be detected and diagnosed. Meaning there should be bodies, workforces trained for detecting and diagnosing this very illness. Again, I also think there should be a proper training of the healthcare workforce, psychiatrists. They as well should be able to carry out their work. They should help us to see the stigma within this very illness towards people. I think the stigma towards people with this mental illness. Again, I think there should also be a preventive measure
Thank you, Delegate.
which
Your
could
time is
come.
elapsed.
Right. Sorry,
Moving
am I
on.
audible, please?
Yes, Delegate. Your time has elapsed. Your 1 minute is up.
Oh,
Moving on.
sorry,
Delegate of
thank you.
Nigeria. Nigeria. Last call for Nigeria. All right. Guatemala. Delegate of Guatemala.
Okay, so in addressing the issue of mental health and proposing some solutions, Guatemala, the people of Guatemala would like to propose the OPI to our where this is a structure for addressing for proposing some solutions. And then the first solution I'd like to propose is the first solution the delegates of Guatemala would like to propose is addressing the issue of mental health stigma through awareness campaigns. Also would like to encourage the government of member states to invest in mental health and provide funding in order to enlarge their facility in order to construct more mental health facilities so that people can gain access to them. Additionally, we like to tell the member states to promote courses for mental health so that their healthcare providers can be trained in mental health so that they can provide the necessary help needed. Thank you.
Thank you, Delegate. Moving on. Nigeria. No, sorry. Myanmar.
Am I audible?
Yes, Delegate.
Yeah. So, possible solutions to current policy-related problems in regard to mental health include development of cheaper, user-friendly methodologies and instruments to access mental health needs, scaling up of mental health services through fundraising and equitable distribution of such services, identification of risk factors for mental disorders through well-planned research and systematic reviews so that primary prevention strategies can be built on the evidence generated. Unavailability of early detection and management could be considered a risk factor for disease burden as well. Relevant research in the second area is equally required. Some of the harm reduction strategies globally hand in hand with evidence-based prevention and promotion interventions to deal with substance abuse problems. Planning of advocacy activities, anti-stigma campaigns and fundraising within research-based formats. And then finally, unification of substance abuse and mental health units under one umbrella. Thank you.
Thank you, Delegate. Moving on. Hungary. Delegate of Hungary.
Okay, thank you for the opportunity that they've given to me. So, I'm representing Hungary country, and this country also facing the same problem of mental issue. And in what they do about this issue in 2000, in year 2000 and 2010, the suicide case affected by this issue, but the mental issue is getting increased, and for that they are doing to um, paying attention for the children and also adolescents. So they made like an organization to for these people, and then what I get now the result for when the problem comes like COVID-19, the mental problem get decreased, and then around like 16%. So I agree, like Thailand said, that we must pay attention from the children and adolescents also.